Hi, guys. Welcome back for our daily practice questions. As always, y'all know I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners with exam success. Now, y'all know I like to always go over my disclaimer and reminder that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. We have been working through a series lately, right? And so this week I will be doing COPD. We have done asthma, derm, diabetes, hypertension. So I figured let me get COPD in there as well for you guys. So question number one states, a 68-year-old male presents to the office today with a history of smoking with 40 pack years and complaints of increased dyspnea, chronic cough, and sputum production. On examination, he has decreased breath sounds and wheezing. What is the most appropriate initial diagnostic test for this patient? Is it A, a chest x ray, B, ABGs, C, spirometry, or D, a CT scan of the chest? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So here, the stem of the question states, what is the most appropriate initial diagnostic test for this patient? All right, so if they're asking you anything about a diagnosis, a diagnostic exam, you need to run it back and look at the assessment findings so we can gauge what we're working with and what we're trying to tailor and determine a diagnosis, right? And whatever differentials we're beginning to think based upon those assessment findings, that's going to let us know what diagnostic tests we need to do. But also, reading the stem of the question lets us know we need to think of the first diagnostic exam. So, as I always tell y'all, make sure you know those gold standard exams because this says initial, right? So, this patient came in, has a smoking history of 40 years, 40 pack years. They're having increased dyspnea, chronic cough, sputum production, and on exam, their breath sounds are decreased and there is noted wheezing, right? So this should start to put you in the mind of COPD. So gold standard is C, spirometry. All right, question number two. A 70-year-old female patient with a diagnosis of COPD presents for a follow-up appointment. She has been she has been using a SABA as needed, but continues to experience frequent exacerbations. What is the most appropriate step in her pharmacological management? Is it A, increase the dose of her SABA, B, add a LABA, C, start systemic corticosteroids, or D, recommend pulmonary rehab only? Tell me what you got. All right, here the stem of the question states, what is the most appropriate step in her pharmacological management? So, all right, what do we have going on here? We have this patient. So basically, this is a treatment question. So I always tell y'all if they're asking how to treat something, you got to run it back and see if they gave you a diagnosis. And if they have not provided the diagnosis, run it back a step further and look at those assessment findings so that you're able to determine the diagnosis, right? But here it lets us know that this patient does have COPD, but she's 70 years old, a female, and she's back for follow up. She's already has a SABA on board that she uses as needed, but she's having more exacerbations. So we know we need to add something else on to this management, right? So, I always tell y'all when we're doing COPD, if they're starting with this SABA for testing purposes, stay with that drug class, right? And just work up that way because you can also use a SAMA, the muscarinic agents, aka anticholinergics, right? So a SABA, like your albuterols, so she's already on that rescue inhaler. So now we need to put in a LABA, a long acting, right? So B is your best answer. And then lastly, question number three. A 60-year-old male with moderate COPD is being educated about self-management strategies. He expresses concern about how to manage his symptoms during an exacerbation. Which of the following statements should be included in his education regarding action plans for exacerbations? Is it A, you should avoid all physical activity during an exacerbation? B, increase your use of rescue inhalers only if your symptoms worsen? C, if your symptoms do not improve with your rescue inhaler, you need to seek medical attention? Or D, you should stop taking your regular medications during an exacerbation? Take a moment and tell me what you got. Tell me what you got. All right, so here the stem of the question states, which of the following statements should be included in his education regarding action plans for exacerbations? Right, and so this one, you're considering the most appropriate and therapeutic communication, right? But C is your best answer because if their symptoms worsen and do not improve with the rescue inhaler, they need to seek medical attention because it may warrant additional medications, and that may be the actual reason for the exacerbation. So C is your best answer. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. And make sure you're following along because we will continue to build. You know how I typically do with our series. I start from a foundational standpoint and work up so that your knowledge is stronger and then you are applying it to more in-depth questions. So continue to follow this week for more COPD questions. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, make sure you include the number one at gmail.com. The things that I do offer are my review book. You can get it in an ebook or paperback option. Those are both linked in the bio of this channel. If you prefer to study independently, my self-paced review is also linked in the bio of this channel. If you're looking to do any practice questions, my QBank options are linked in the bio of this channel. And if you're looking to book any one-on-one sessions with me, I always say either reach out by calling, texting, or emailing because I have a variety of one-on-one session types. And I like to speak with you guys to gauge what you truly need to make sure you're booking the most appropriate session for you. Okay. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.